Friends, there are two kinds of patients who come with phimosis. When you reach your urologist with the problem of phimosis, that means your penile skin does not go back comfortably beyond the coronal sulcus, both during non-erect and erect states, then you are suffering from phimosis. And unfortunately, because it has been a gradual process or process since birth, thereafter growth from toddler years and adolescence to your maturity, many a times we don't appreciate that this is a change which was always happening. While the organ grew from a baby to an adolescent to an adult, the skin covering it did not grow to those levels around. And if it did not grow, the skin lagged behind. The skin is a protective cover which was given to you, but the protective cover may not always be required. It may be required in those in whom it is very pliable and in which whom you can actually pull it back and maintain a great hygiene, which you continue to do every day. But in those individuals who are not ritually circumcised, those who have not undergone a circumcision in childhood, and those who have a tight prepuce, they continue to live an agony, which could be either premarital, which could be immediately post-marital, when they wake up to a phenomena when they have their best of capable erections and they're not able to pull their skin back. It becomes a hindrance. It becomes a hindrance of that kind where you are not able to perform. Your performance becomes an anxiety issue all the time for you, and then also translates to your partner. So a phimosis where your skin cannot be pulled back, the skin gets pulled back with difficulty, pulled back with an issue where it's an anxiety that it may not get pushed back, or you will end up with something called as a complication of phimosis called paraphimosis, something where it's going to get injured again and again. By every time you pull back, there are tears and lacerations around, and those injuries continue to happen slowly. You are in a state of phimosis, you're in a state of a progressive phimosis if you're diabetic. So diabetics get acquired phimosis. That means with diabetes, changes happen in that aspect of the redundant prepuce, which gets inflamed again and again and gets infected. And that infection possibly leads to chronic Balanoposthitis, adhesions. The skin out there becomes very flimsy and tears every time you have an erection or you attempt to pull it back. So this is a progressive acquired phimosis situation as a result of chronic, acute or chronic Balanoposthitis or infection out there. What do we do? In such situations, living in dilemma in your cities and not seeing the right doctor called urologist in your city would actually give you the trouble where you continue to live in agony. Applying ointments and creams out there does not work. It's a tight skin. It is getting inflamed, infected, injured, traumatized, getting a discharge and redness. And applying an ointment would not work because you need to go to the bottom of it rather than treating the smoke. You need to probably quench the fire. That means you got to look at and get to the bottom or the cause of it. So phimosis is treatable. And why live on the edge before your marriage, during and after your marriage when you're not able to perform, or when you're not able to maintain a hygiene, or when you find your erections are getting tough only because the covering skin, which did not grow with time, the way your organ grew, is not able to match the capability of being pliably pulled back and maintain hygiene or help you in the erection. In other words, it's time for all patients who are phimotics, who are not ritually circumcised, whose skin is very tight, to not go through the trauma of being treated for recurrent urinary tract infection. That's a very important wake-up call. You know what happens? Men may not be knowing how to give a proper urine sample. A urine sample which is to be given for testing is always a midstream and a clean catch specimen. That means you pull your redundant prepuce back, wash up the whole area very well, start passing urine, and the first part of urine does not go to the bottle. It goes to the toilet. So as you're passing urine into the toilet, the middle part of urine goes into the bottle without touching the bottle and touching your outer skin or prepuce, because the prepuce is normally contaminated. It's contaminated by the resident bacteria, fungus, and microorganisms, which actually could, if not knowing, be spilled into the bottle which is being tested, and a wrong report is being available there as a mixed growth, or those bacteria which are actually colonizing or guarding your organ at the level of the prepuce. So they're commensals, they're sitting out there, and that could be given in the bottle. So for all patients who have got a tight prepuce or phimosis, if you give a urine sample, it is impossible to give. You give a sample which could be contaminated, which could be through this inflamed organ which is undergoing an acute Balanoposthitis, or those individuals who possibly cannot retract would be giving a sample through that. And all those are contaminated samples. Are we not busy treating your sample rather than treating you? The urinary tract infection which emanates as a result of poor hygiene in a case of phimosis, where the bacteria could be to and fro and sometimes getting into the urinary passage as a result of absent hygiene or hygiene which is demanded more of you that cannot be brought out. It is time to wake up to phimosis. Phimosis is treatable. It's a congenital issue, or as I said, in an aspect of diabetics, it's called an acquired issue, where I call it as an acquired phimosis. So all diabetics who are long-standing, all diabetics who are uncontrolled, and who get redness and skin tightness and small cuts on the skin at the tip when they clean it up, are actually acquiring a phimosis. With every inflammation which heals, which you apply ointments and take tablets around, there's an amount of tightness which develops, apart from the inflammatory component which is happening around. And all this could lead to an acquiring of phimosis, which is tight, which is inflamed, which is dirty, which is red, and its cure will be no more ointments and tablets. You need to see your urologist. Somebody who would do probably a cosmetic and a functional job out there and remove that extra tight skin, the skin which is not required, the prepuce. That phimotic ring, which results as a result of being tight and which could not be loosened up by a gentle care which a mother did in the 3 to 5 years when the adhesions were gradually disappearing, or as I said, as a result of acquired Balanoposthitis, can actually be cured by a good circumcision. A circumcision many a times is attached with frenuloplasty. The frenulum is a very short attachment on the ventral aspect, which many a times could be too tight, which could be loosened up. So circumcision frenuloplasty is a treatment, and traditionally the circumcision done by an open technique with fine absorbable sutures has done wonders for patients across the globe, and it's again continue to do better and better. So for all individuals who have got phimosis, who have tight skin that they cannot retract, they continue to live with urinary infection as a result of require of demand, which is as a result of bacteria sitting there getting infected again and again, seeing their colleagues, dermatologists, and applying ointments, may possibly require a circumcision. A circumcision is a cure. So C for cure, C for circumcision, for P for phimosis. So have a passion to move forward and protect yourself from recurrent urinary tract infection, and protect yourself from the anxiety that goes through when you get a good erectile function. So erectile function gets disturbed when you have an anxiety where the skin could be a trouble during a wonderful activity that you perform in the bed. So circumcision is a cure for phimosis. Postponing it and waiting for another day when you can have trouble is not what is expected. So if you are aware of a phimosis, get a circumcision done. And a traditional circumcision by excising that extra amount of skin, cosmetically measured by the urologist on the table, and clearing it off and applying some fine sutures which heals over the next few days. The sutures dissolve and probably wash off on their own by hydrolysis, is the way forward which has been and will always be. Wish you good luck to all those who actually are watching this, because phimosis is something which is again an agony, again a disgust, and a kind of issue where you continue to live in rather than getting a cure. So aim for cure and you get cured.